The whole personal injury business is just a horror show. It's designed to make people, the glass look half empty. And for the first 15 years of my career, I did a lot of personal injury. And I did it trying to make people better, and then I came to the realization that they don't want to be better, because if they weren't better, if they get better, they don't get paid. Understand that there's an algebraic formula involved in automobile accidents or in any personal injury case. When you're involved in a car accident, there are three parts to your insurance policy. The first one is collision and comp. Okay? In other words, nobody's going to complain about the fact that if your car is stolen, that they reimburse you for it, or if somebody whacks into you, that they're going to fix the car. That's collision and comp. The second is healthcare, personal injury protection. Okay? There are two ways to deal with that, either with fault or no fault, but most people would say that if you're injured, you should get your medical bills paid. The third is the sticky one, and that's liability. That's pain and suffering, and the damages that you get. That's the third part of your policy that you pay for. So how do they base a pain and suffering settlement? Generally on the amount of medical bills. So if the amount of medical bills are X, simple algebra, generally the plaintiff's lawyer will demand 3 times the liability settlement, the amount of medical bills as a liability settlement. So if there are $50,000 in medical bills for a routine motor vehicle accident, the lawyer will then demand from the insurance company a liability payment of $150,000. Now, what does the lawyer get paid? He gets paid 1/3 of the liability settlement. So the amount of medical bills is X. The liability settlement is 3X. The lawyer's fee is 1/3 of 3X, which is X. What does that mean? It means there's a direct relationship between the amount of medical treatment and how much the lawyer gets paid. So if someone gets involved in a routine car accident, little fender bender, 10 miles an hour 5 miles an hour from the rear, little whiplash injury, and he sends all his patients to Dr. A. Dr. A treats the patient for a month, does some physical therapy, a couple tests, generates $4,000 in medical bills. He sends the same patient to Dr. B. Dr. B treats the patient for 3 months, does 4 invasive pain management procedures at $20,000 a throw. Now it's $80,000. Now you tell me, the next patient that walks in the door, who's the lawyer going to send the patient to? Dr. A, where he's going to get 1/3 of $4,000, or Dr. B, where he's going to get 1/3 of $80,000? You answer that. Of course, where do the cases come from? Most of them come from 3 sources. Hospital emergency rooms, where they're paying somebody for all the medical records. Insurance agencies, when somebody calls in a claim, they're being paid back from calling the lawyer about all the people claiming accidents, right? And the third one, let's see, is policemen. So what they do is they go to the local police station, get all the accident reports for that day, and if you're in a minor car accident, you will have 8 letters in your mailbox from lawyers within 3 days, because somebody has gone and bought all the accident reports up. Public record. So that's where all the cases get. Now some people say, to hell with it, it's only a minor, but some people make a living. So there's a 1995 accident, there's a 98 accident, there's an 02 accident, there's an 05 accident, there's a 10 accident, and this just goes on and on and on and on and on. It's a malignant system. And it's going to be run by lawyers. Doctors aren't going. Nobody. You know, the real fly in the ointment here is that you treat patients who are involved in auto accidents. Now the logic would be that if a car A crashes into car B, both parties are injured. They both have the same impact, they both do this. Why is it that 99.9% of all cases are people who are the victims? What happened to the drivers? The people that caused the accident? They never get treated. or they get treated once, go to the emergency room and go home because there's no motivation. Nobody's contacting them saying, you can be treated. And then they all become self-fulfilling prophecies. After a while, you crack somebody's neck enough in your back and you tell them you got 3 herniated discs in your neck and 4 in your back, they go, I'm really sick. They don't know that everybody their age has exactly the same looking neck and back and the same herniated disc who haven't been involved in a motor vehicle accident. It's an extremely malignant system, and I have no idea how to get out of it because there's too much money to be made.